Is it worth it to get a hair transplant without finasteride? Hello, I'm on the edge about getting a hair transplant. The thought of taking a medication for the rest of my life, concerned about side effects, seems rather unattractive. I've seen results of patients that have not had to use finasteride, and they look great. I'm 21, but I'm willing to wait till I'm older. That being said, if my father, pictures attached, were to have multiple hair transplants without finasteride, would he get full coverage as the result, or would his hair look like it is still thinning? Thank you.
Thank you for your question. You state in your question that you are on the edge of getting a hair transplant and that you don't want to take finasteride, you don't want to take a drug for the rest of your life, and that you have observed results of people who have gotten hair transplant without finasteride which appear to be impressive. Further, you submitted photos of your father's scalp to ask whether or not he were to get full coverage without taking finasteride if he were to undergo hair transplant. And I think that this is the basic gist of your question, essentially, can you get a hair transplant without taking finasteride? Well, certainly I can share with you what is important information that I discuss with my patients when it comes to management of hair loss. And I think this is the key to understanding hair loss is managed, and no matter what, you're not necessarily in any way considering a, quote, cure, but what you want to do is get the best appearance to have that works for your the look that you want to achieve. A little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of Tricostem Hair Regeneration Centers. This is a system we've developed to non-surgically treat men and women with androgenetic alopecia or genetic pattern hair loss, which makes up 95% of hair loss patients. I think first, to answer the question about your father's scalp, I think that in every hair transplant consultation, the discussion is essentially pretty similar. The goal is for transplant is not to cover the entire scalp because there's intrinsically a mismatch. Whether it's with an FUT or FUE, you have a limited area of harvesting from the donor area in the back of the scalp. Yes, you can get body hair transplants, but let's stick with just that. But the scalp, the top of the scalp has way too much surface area for you to be able to cover everything. So doing hair transplants for as long as I have, I always discuss with my patient essentially the goal, which is to frame the face, to create essentially a frontal hairline as well as coverage to the mid-scalp to get a natural transition. But what does hair transplant not do? It does not do anything to the progression of hair loss. Now, speaking to your concern, even though you didn't submit a photo, if you're 21 years old and you're on the edge of having a hair transplant, it might be fair to conclude that you are losing hair at a relatively aggressive pace. And that speaks to many issues about the feasibility of hair transplant. You see, when it has been generally a standard amongst hair transplant surgeons to limit or avoid doing surgery in men under 30. Why is that? Well, when it comes to hair loss, if you have an early onset and a relatively rapid rate of progression, then the hair transplant is not likely to be able to keep up with your rate of progression. The typical ideal candidate for a hair transplant, in my opinion, is a middle-aged man with a later onset of hair loss who has more of a frontal balding progression. So basically they have a later onset, a slow rate of progression, and they need hair in an area in the front where a transplant can be placed, and their rate of progression is relatively slow, which means that they may or may not choose to take finasteride, but they will appreciate and get the benefit for many years. Hair loss will still progress, but that's in contrast to a younger person who has an early age of onset, rapid rate of progression, and more advanced loss. This is not somebody who is an ideal hair transplant candidate. I think it's very important to understand that there is no cure, but there are strategies to manage hair loss. So when I meet a patient who is in their 20s, and we have this discussion every day in our practice, we treat patients with hair regeneration from around the world. And briefly, this is a system we developed out of helping patients with hair transplant. The challenge with hair transplant has always been getting really effective coverage, getting the survivability of the graft to be maximum, as well as minimize the scarring. But with transplant was always the challenge of maximizing the longevity of the appearance. And that meant encouraging our patients to take finasteride to slow down progression. It is my perception that although finasteride may be more effective for some people compared to others, a lot of this has to do with really a relative the specific genetic pattern and the relative aggressiveness, as well as relative sensitivity to DHT. So arguably, someone who has a later onset has lower DHT sensitivity than someone who has an early onset. It's not exactly always black and white like this, but I think it's a good framework to decide how to manage a person who has hair loss. So a lot of our younger patients I will talk to about considering taking finasteride. I provide them the clinical information that is relevant and not just what is the information that's more popular on the internet, as well as a strategy for hair regeneration treatment. Essentially, hair regeneration treatment is an injection treatment combining platelet-rich plasma with acellular matrix based on algorithms I've developed over the past 7 to 8 years. And those algorithms are based on gender, age, age of onset, rate of progression, degree of progression, and other medical factors in terms of dosing, timing, and placement of this injection. However, I would uniformly say that most younger people, I would have this discussion about finasteride. Patients will choose whether or not to take the drug, but it is part of that discussion. Hair loss is progressive. Everybody eventually loses hair with rare exception, but it is essentially depends on when that hair loss begins and how aggressively it progresses in determining who is a good candidate for transplant and who isn't. Even people who have a later onset, if they have a more diffuse thinning pattern, they're not going to be a great candidate for transplant. Like I said, the ideal candidate from my perspective is a middle-aged man with frontal balding. That is the ideal candidate. So someone, when you talk about your dad's situation, yes, I would still encourage someone with that hair loss pattern to still consider finasteride, but it is a different rate of progression compared to a younger person. So I think it's important that you learn all this, do some consultations, figure out what works best for you. I tell a lot of our patients also who are in their 20s that before you think about taking a pill for the rest of your life, understand that a lot of people, and being in practice over 20 years, I can tell you this from experience, that a lot of men may think that hair is important to them in a certain stage of their life, but as they get older, they may consider it less important. It's a personal decision. So I'll say that if you are committed to managing your hair loss, well, it probably makes the most sense to use every tool you can and not just ignore something. Now, people who are more middle-aged or have a later onset, they have a little bit more breathing room, but there's also typically less of an urgency related to their situation compared to younger people. So I hope that was helpful. I wish you the best of luck. Thank you for your question.